right, so I think we're going to get the program started then this afternoon. Is that right?
Yes, we are.
All right, wonderful. Well, first and foremost, thanks to everybody that has carved out the time to join us this afternoon for another Lunch and Learn event. We're pretty stoked about this topic, implementation strategies for community corrections. We're hoping that we can, shed some light on some things you might be considering as you are implementing, new features of your program. As we sort of step out of the darkness of these past 16 months, I'm sure that the field will be brimming with energy and ideas and vision. And so we want to make sure that, we're kind of providing folks some steps to follow if they want to kind of cash in on that enthusiasm that we're going to be seeing as things start to open back up across our state. So first and foremost, again, thank you. I want to bring our Deputy Commissioner and Director of OPCA, Bob Macarone, to the mic here to give us a welcome, and then we'll get the program going. Bob?
Thank you, Dan, for that nice introduction. And I see we have over 50 participants on now, and it's increasing rather dramatically. So I want to recognize both the ATI and the VERA units for their work on this with the community corrections field. And looking over the slides last night, I was so impressed with the thoughtfulness of the comments and the slides. I think you're really going to benefit from this presentation. And it just occurs to me that, while it concerns the implementation of community corrections program, I think Dan got it right, and that is, even if you're making a change, change is difficult for all of us. We get very comfortable in our positions, and we think the program's operating, just as effectively as it could. Certainly are all working very hard at it. But the truth is, from time to time, we have to make changes in the programs. It might be just implementing some years ago, as we did, a cognitive behavioral intervention program into our reentry task forces to make them more effective, to address the criminogenic needs of individuals returning from prison. That was a major change. That was a shift in formalizing that component. And how do you implement that? We did something similar with the jail-based programs, although certainly we envisioned that as a component from the beginning. But in order to be successful, programs have to change. And how do you endorse? How do you welcome? How do you embrace that change? And more importantly, what are the tools of implementing that change effectively? And I can tell you that looking over the presentation today, the staff have been very, very thoughtful in including the tools, which are quite impressive to assist you in contemplating that change. I see many, many of our friends out there in the community, so I won't mention any by name and get in trouble for that. But Tania Chandler is our presenter today from TASK program. And I do want to thank you for participating in that capacity. I also want to take this opportunity to congratulate you on your promotion. Well-deserved. You run an excellent program. So I've got to run to another meeting, and I wish you a successful and a happy webinar today. And I want to wish you and your families and your staff the best in the future, relaxing weekend, and certainly continue to take good care of yourselves. Thank you, Dan.
All right, so let's go ahead and get this thing going here. So we'll move to the learning objectives. We have 4 that we want to really kind of tackle today. We'll kind of put this out right up front that, we could be talking about implementation for the next week, the next 2 weeks, the next month, because it's a pretty complex thing, project management and actually getting something implemented into a program. But we're going to kind of pare it down, focus on, what we think are kind of the most important elements right up front, and just sort of put some context around these things. So first and foremost, develop an understanding of what drives change at an agency. I think that once we understand what is actually driving the change, that's going to really help us to strategize how we want to actually attack the project. Understand the importance of readiness when beginning a project. Obviously, that's going to come down to multiple factors, which we'll get into. Identify some key components of effective implementation, Rarely is it as simple as, okay, here's an idea, we're just going to go do the thing. There are steps that we need to take to make sure that we're doing it right. And then, most importantly, we want to make sure that what we're doing is working. So we want to learn how to actually measure the effectiveness of our work. If the goal is just to implement something and do nothing else, we probably could do that. But if the goal is to implement something with a desired outcome, then we're going to have to be really purposeful in how we're assessing that. So that's those are going to be the 4 key areas we're looking at today, and then we'll get into things here. So we just kind of to set the tone here with a quote right up front, and if you do not change direction, you may end up where you're heading. In some cases, that might be exactly what you want. You're heading in the direction that you want to head in, but sometimes we lose our way, and sometimes things come up in our professional lives or the world around us that does cause us to have to pivot and change things. So, so that's kind of what we're going to talk about here. So I think before we can make a change, we need to really ask ourselves, what is driving this need for change? Is this something that is coming from an external source? Is it something that's coming from the agency or the program itself? Because as I said in the beginning, once we can better understand what it is that's motivating the change or driving it, we'll have a better sense for how we can get to where we want to get to in the end. So just a few different sources that it could come from, all of them viable, all of them legitimate, all of them good enough reason to undertake a project. And it might be something as simple as just a desire to change the program model. Perhaps it's the programming that you're offering is not hitting the marks that you are hoping for it to hit. Perhaps the staff isn't really catching on to the spirit of what it is you're trying to do. So it could just be a very simple desire to want to just sort of shake things up. Contractual requirements, obviously, is going to be something that's going to drive change in organizations and programs as well. As contracts expire, they're renewed, as different expectations are put forth. There could come a time where you're going to have to make a change and implement a change in order to just stay current with contractual requirements. Then we have changes in the community where we're actually operating the program. Having the support of a community is great, but sometimes we don't have it, and that can really influence our longevity and our success operating in a given community. Thinking about things like the loss of industries in a geographic area, accessibility to public transportation, things like that, right? So the actual physical geographic community in which we're operating could be a driver of change as well. The loss or gain of essential resources, this could come by way of any number of sources, right? So it could come from a grant award, so something positive, or donations, or it could come as a result of a loss of funding or a reduction in funding. So really, if we're looking at it from sort of the positive or the negative side, that either of those things could be driving change in an agency. Next slide, please. Another change that we felt important to talk about here is in response to social changes. I think that the past year has given and should have given all citizens, certainly, a lot to think about with respect to race and equity, with respect to sexual orientation, origin, and things like that. And we have to respond in kind when those moments come up. That could be a policy change, that could be a program change. But I think that if we sort of turn a blind eye to these significant changes that are happening in the world around us, that we kind of miss the boat in a very big way. Another driver of change is going to be the passage of new laws. So we've seen this in the raise the age legislation. We've seen this with bail reform coming through. So those things are necessarily going to change the work that we do and the type of work that we do. We are a human-centered business, obviously. Having good staff is everything. Having staff at all is everything, right? And so there are going to be times when losing a single staff person could mean really having to change an existing program model. That person is really integral to it. Same thing with if you are adding staff members, if you're increasing your capacity and that sort of thing, that could also be a reason why we are kind of moving towards change. And to hit these last two pretty simply, one could be in response to audit results, right? So we might come through and do an audit of the program. We might identify some different things that need to change to keep you current with the contract or for better practice. But ultimately, I think that the primary driver of change in a lot of organizations is to really better align with what you are trying to get out of it, right? So if you say that the goal for your program is to get 90% of them through successfully within a 6-month period, but you've only been able to get, say, 60% through in a 6-month period, the outcomes are not aligning with, what you want to happen in the end. So when we notice that there's a disparity there, that's another reason why we would choose to change something. Go to the next slide, please. And so, once we have decided to make a change, if that was not hard enough, now we have to think about when are we actually going to do this thing, right? And, I kind of like paint the picture. I know I've definitely been there myself. You go to a training and you're there for a couple of days and everything is great and you're feeling good, you're feeling energized, you have all these great ideas. You want to go back to your program and talk to your bosses and talk to the staff and say, hey, we need to make these changes, blah, blah. But then you get there and the operational reality is not in a place where they can really accept that work to be done yet. That could be as a result of not having the staff, not having the capacity, not having the resources or whatever. So really trying to understand, when to start the project, I think is pretty pivotal as well in kind of the grand scheme of things. So, you have to ask yourself questions like, how urgent is this need? Is this a need that, needs to be filled immediately because there are, real, there's kind of stuff on the line, or is it something that can be kind of dealt with slowly over time? Has the deadline been set by stakeholders? So perhaps it's a matter of, well, hey, listen, we got this contract out there, we need this implemented by this date, and there's no two ways around it. And then you might also want to take a look at what you actually have on your plate, right? Because, I know for me, one of the worst feelings is to have multiple incomplete projects and then have another one and another one and another one just kind of dropped on me. So making sure that we're completing our work, I guess, before we can move on to kind of these bigger projects is something that's worth considering as well. This quote, not to make it sound real like doom and gloom, but I mean, I think that this is pretty legit though. Prepare the umbrella before it rains. That's not saying to expect the worst, and that's not saying that we should expect, failure, but I think that this does sort of say to us that we can expect anything, right? Which could be easy path to success, or it might be a path to success that has a few more obstacles than we anticipated. And I think that kind of asking ourselves some questions and really taking stock of ourselves and our capacities and assessing our capabilities is what's going to really kind of put us in a position to be prepared for anything. So we kind of put together just about a half a dozen or a dozen questions here that you might want to ask yourselves as you're considering taking on a kind of a big project at your agency, right? Some of these are going to be kind of no-brainers, and some of them might be some things that you might not necessarily immediately think of. But let's go through these, and these are going to kind of echo some of the things that we've already spoken about. One is, of course, does the change align with programs or the agency's values? Is this in your wheelhouse? Is what you're talking about adding something that you've already done, or are you, starting right from zero? And if so, is that in line with how you intend to, run the program? Does the change or the project meet all of the ethical and legal considerations? So I'm thinking about things like, ethical considerations we might see from National Institute of Corrections, American Correctional Institution, International Community Corrections Association, or even the ethical guidelines of your own programs. Have you gotten stakeholder support? Is this something that your stakeholders driving? If not, do you need to seek their approval? Do you need to get their explicit blessing in order to actually start this process? Does the change support client and participant rights? We certainly expect that all agencies have their own, client and or participant rights that every person that walks through their door can expect. And so, is the change in line with what your clients have come to expect from you? And finally, is the change in compliance in violation of the contractual terms, right? So want to make sure that it's hitting all the notes. Next slide, please. And a few other more kind of human-centric considerations for you to make here. One is, do you have the human power to actually start doing it, right? That means, do you have the proper number of staff members to actually get this done? Do they have the resources that are necessary to actually get the work done? Have they been trained in the task at hand? Have they been briefed? And I think maybe one of the most important kind of questions to ask as a third one down is, have they bought into the process? Certainly managers out there, heads of agencies that are with us can probably attest this better than I can, that when you don't have that real, legitimate, honest-to-God buy-in where people actually believe that what they're doing has a purpose and that there are actual, outcomes attached to it, get them really believing in it, it's really, really hard to implement something kind of full bore, because sometimes it really does take, one person or two people that might not be on board that can cause the thing to go sideways. So, doing what we can to make sure that staff are bought in, I think is extremely important. And how do we actually do that? And I believe that the way to do that is by making sure that it's inclusive, making sure that we're engaging staff members at all levels. Anyone that might have any involvement in carrying out any part of the objective, I think should have a voice in the process. And those voices should reflect the diversity of the staff and the clients and the community. That all of those things should be taken into consideration, right? So we don't want to kind of embark on these projects and, with blinders on, that we want to bring other people into the process because we need other people to make this stuff work, right? And then finally, something to consider is, do you need something a little bit more formal, say, when you're embarking on this project, a strategic plan with actual benchmarks, or is it something that you might be able to play a little bit looser? These are, again, there's not necessarily specific answers for any of these questions, but this is just sort of food for thought. That, again, I wish it was as easy as being able to say, poof, we added this piece to the program, it's implemented perfectly and working well. But we know that that's just not the case. So just taking a few extra steps in the early part of the process, I think, can save a little bit of stress on the back end if we're being really thoughtful in the considerations we're making up front.
Okay, so this is where I pick up. Thank you, Dan. This is Michelle Clark. I'm the manager of the Vocation, Education, Employment, and Reentry Unit here at OPCA. And I just want to talk to you a little bit about the successful implementation strategies outlined in the next few slides. A lot of what I'm going to talk about does cover some of the things that Dan already shared with us, but this information is directly from the National Institute of Corrections in terms of the key steps to successful implementation for community corrections. So successful implementation requires that we evaluate our needs and decide upon these specific parts when we want to accomplish the mission of our program. So for example, for bullet 1, what are the skills of your employees, as Dan had mentioned? Are they trained in MI, for example, which is motivational interviewing? How do they interact with participants? The second bullet about decisions on intervention assignment. How are we deciding which programs or services our participants need? Are the participants involved in this decision making as stakeholders? The third, programming. What programming do we offer, and do these services address the needs of our participants? And the fourth, incentives and sanctions. And this goes for both working with individuals, participants, and as in terms of staff with accountability in mind. Do we provide appropriate incentives, sanctions, and accountability, both positive and negative, in our programming? Next slide, please. So successful implementation also includes these three parts, key components, community linkages, our staff linking with community providers to broaden their network and make solid connections for clients and services, case management. Do you have a case management system that aligns with helping your clients meet their goals? Is that something that you're interested in doing? And perhaps do you have a policy and procedure in place, or do you want to develop one to support that? Also, the last bullet, organization. Does your organization embrace culturally competent policies, have flexible management techniques, and take stakeholders' opinions and needs into consideration at all levels of your program design? Next slide, please. It's a very interesting quote. I like it very much. Change does not come on the wheels of inevitability, but comes through continuous struggle. And I like this quote a lot because it does speak to how hard it is, to really implement the programs that we know we need for our participants. It's not an easy task. It requires a lot of moving parts, a lot of thought, a lot of resources, of course. So it is a continuous struggle, but it's always worth it in the end. When we get the outcomes that we're seeking for individuals in the criminal justice system. Next slide, please. So the integrated model is something that I think was important to share because it looks at the incorporation of evidence-based principles, which is something OPCA is very, big on, and practices for funded programs. As such, the integrated model of implementation strategies and evidence-based principles is what we prefer to see happening. So unfortunately, just knowing what an evidence-based practice is not sufficient to implement and sustain a certain way of doing business. To facilitate and strengthen implementation and corrections, this model emphasizes the importance of focusing equally on the evidence-based practices, your organizational development, and community collaboration to achieve successful and lasting reform. So when you're looking to implement a new program, we want you to keep in mind that the scope of this model that you're seeing here on the slide is broad enough that it can be applied to all components in the criminal justice system, such as pretrial programs, jail programs, probation or parole programs, or interventions that you want to deliver in probation and parole offices, and also the private and public service providers. And this, of course, stands across varying jurisdictions. So it requires that the integration of best practices from a number of disciplines and a development that is gradually being recognized in the field of community corrections is best in order to achieve better outcomes. Fundamentally, it is designed to achieve lasting change, both in practice and policy, if you use this integrated model. Next slide, please. So for this slide, I just want to kind of pose a question to the audience here, a few questions rather, and please feel free to comment in the chat before I turn this over to our guest speaker. Motivational interviewing, for example, is one of the evidence-based approaches that we support at OPCA, DCJS. So highlighting that particular practice for a moment, I want to ask you some questions to help you think about the ways in which you use resources and skills taught to incorporate best practices such as MI. So, and as you know, and as I said earlier, implementing evidence-based processes and practices is key to our funded programs. So here are some of the questions, and I mean, you can certainly comment in the chat. You can say yes, you can say no, or you can make comments. Are officers and or staff in your programs trained in MI, in motivational techniques? That's number one. So if you want to implement that as part of your program, we have to determine if they're trained. What quality assurance process is in place to let you know that it's being used if your staff are trained? How do you know it's being used? And lastly, are staff held accountable or responsible for using MI techniques in their day-to-day interactions with participants? And how do you know that they're doing so? So ways that you could determine that they're doing so, supervisors perhaps could do group observations, during group facilitation to see if MI is being used. Perhaps it's something that you can ask be used in your regular communication within your agency. Those are just a few examples. So those are just, that's just a way for you to kind of think about if you're going to implement a particular aspect of your program, such as putting MI into your programming. These are some of the questions that you want to ask. Of course, there's many more questions, but these are some of them. The last slide before I turn it over is just to ask you another question about how do you know your program, your services, or your intervention is effective? Like, how do you know if you accomplished what you set out to accomplish within your agency? Did you have a mission to hire more minority women, for example, in your agency? This is just an example. And if so, what was your target goal for hiring? Did you set out to bring, let's say, 25% of the staff in your agency to be minority women? Did you accomplish this goal? And overall, did you examine your recruitment efforts? Whether or not you accomplish your goal or not, it's important to examine your recruitment efforts for this particular mission, just to give that an example. Now, in terms of interventions, we also have to ask ourselves, what are we trying to achieve? Do you want to bring a new CBI, cognitive behavioral intervention, or employment readiness program into your organization? So those are important questions. And we, of course, at OPCA would like these programs to be brought into your agencies and your programming. Gathering data, reviewing, and interpreting data is not an easy task. However, it is necessary when you are looking to see if participant outcomes are truly what if the outcomes that you're seeing are what you desire, such as reducing arrest rates, reducing recidivism, and increasing levels of employment, for example. So working with a research company sometimes is best to help you determine your program effectiveness, and there are many out there that will do this free of charge. For those of us who don't have an in-house research capability, rather. But as you know, DCJS does try to give our program some outcome data when we can, and have provided some of the recidivism data to you for certain program models in order to help you answer that question, like, are the interventions we are using effective? So with that being said, I want to turn this presentation over to our voice from the field, the wonderful Tania Patterson Chandler. She has 25 years of experience working in a non-for-profit social services program. She is currently the Chief Operating Officer for EAC Network, and they provide services throughout New York City, Long Island, Rockland County. As the Chief Operating Officer, she oversees the coordination, integration, and delivery of all programs, multiple and varying contracts, related services, and promotes a collaborative relationship between program area, just to name a few responsibilities. EAC operates the TASK program and has since 1978. And under her capable guidance, TASK projects within EAC's Criminal Justice and Behavioral Health Division have grown to become one of New York's leading providers of alternative to incarceration and reentry program. So without further ado, we are happy to have you, Tania Patterson Chandler, and the floor is yours. Thank you.
Good afternoon. That was a lot, right?
It was a lot. Well
so I guess just kind of what I wanted to stress is some of the things that we at EAC have done over the years when we have had to or wanted to implement projects. I can say that the overwhelming majority of the time, it has been a contractual obligation or something that we wanted to implement in response to an RFP. The rest of the time, we have made changes to programs based on feedback from both staff, clients, and stakeholders, and have garnered that feedback through various types of surveys. So whether it was, exit surveys from clients who were completing, or during stakeholder meetings, asking kind of where the gaps in services were, and then also regular staff meetings and working with the employees to identify gaps in services or things that they think that the clients need that we haven't been able to provide, or that there is just maybe a lack of resources for those types of things. And then some you have to put a pin in when they're identified because they're not easily able to be implemented, and others we have worked to come up with various ideas. We utilize a lot of interns and externs on all levels, from bachelor's all the way up to PhD, to assist in figuring out the gaps, and then also doing research on various interventions that are available. Some of the things that we've done just over the course of years is specifically working with DCJS is when we had to figure out a risk and needs tool. And this is prior to DCJS implementing and requiring Compass. I and some of my staff were looking at what we could use, because for the TASK programs, we're not doing direct clinical treatment, right? We're doing the screening, the interviewing, assessment, placement into treatment, case management, and reporting to the court. And we rely heavily on the treatment providers. And so us figuring out which treatment providers we should work with or where the client should go was one reason why we said we needed to implement some type of risk and needs tool. And so how that started many, 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 many years ago is that I had a wonderful intern who basically scoured and looked to see what was available in the realm of risk and needs tools that fell into the type of populations that we worked with. Took that list of what she found, met with our both supervisory and programmatic program directors, and looked at all of that to say, here's what the tools are, and kind of broke it down to see what things we could implement or what things we thought would work. And then did a lot of communication with various vendors to figure out if there were costs associated, what was free, how we would look at fidelity and things like that. So that, it takes time, but I am infamous for figuring out how to utilize resources when you don't have money. And so that's where it comes in, where you're using things like interns or giving special projects to staff who are looking for advancement, and using those types of things as professional development. Another one that we kind of were on the cusp of is using interactive journaling as a cognitive behavioral intervention. And that came about because we wanted to figure out a way to make sure that clients were getting a certain number of hours of services outside of their various treatment services, and using it as a means of shoring up the case management relationship. And so then that's when we were looking at interactive journaling, worked with the change companies to figure out which ones would work best for the various populations. And so that is something also that we looked at. And again, a lot of it was surveying the staff, surveying the clients, surveying the stakeholders. There's other opportunities for things where you have, in the past, we have had stakeholders come to us to ask for us to fill gaps in various things, as far as like enhancing case management in drug courts or mental health courts, and then figuring out kind of what we do best and how that could be of assistance to other projects to help kind of shore up and piece together things so that everybody is working together, but the clients get all of the services that they need comprehensively. One other area is integrating peers into our programs, and that is another one where we did a lot of research and had a separate project that was that we were working on in collaboration with one of the drug courts that had federal funding. And because peers peer integration was had been something that was talked about a lot with the drug courts, and this is going back years, it was thought to add that to the enhancement project so that we could see if it worked there, to then try to implement it with some of the task programs. One other thing, well, two other things, is that if getting involved in demonstration or pilot projects helps a lot to kind of gather data in order to figure out if it's something that should even be brought to our programs, or before actually just full-fledged implementation. To get the buy-in from both the staff and the clients, I think the biggest part is making sure that they're involved in every step of the process. And like the first thing, like I said, is starting with the surveys, right? But then don't just end there. Making sure that they're given the what you got from the surveys and kind of where you're going. And you don't want to kind of just leave them high and dry. If it turns out that the survey comes out something that you're not going to implement, you want to let them know as well, why you didn't go that way or why you're starting over. And I think gathering all that information, making sure you're giving, appropriate and timely feedback and making them part of the process helps with the buy-in of everything. The, client graduates and clients who are existing in the currently in the program are a world of resources. They will let you know what they think was good, better, and different, or what can be improved. And I think that is definitely valuable information that could be used to figure out, how to move forward. We rely heavily on, like I said, my staff who are directly working with the clients to bring feedback to their supervisors and kind of push it up so that we can figure out if there are gaps and what we should do. The actual implementation process of things, once you do get the buy-in, is again explaining everything. Is this something contractually that we have to do and we really don't necessarily have a choice? Is this something that we want to pilot? But again, making sure everyone has all the information so that they kind of know what they're doing. There's a lot of pieces that we had to look at, as well as if there's something that we're changing or implementing, how much time is that going to add to what staff has to do? What impact is it going to have on the staff and impact it's going to have on the clients? A huge thing also is how will the stakeholders receive it? For instance, when we were contractually obligated to add a risk and needs assessment, we had to make sure that the defense bar was aware and understood how it would be utilized. They had, some issues as far as thinking we would go into court and say this person is high risk, high needs, and then that would have an effect on how the court looked at the person, and kind of making sure that they understand how we got to that decision, what we're using, and how that information will be utilized going forward. So it really is about, communication and kind of figuring out where the holes and the gaps are, and then also looking to see what your staff is capable of doing, who needs to be trained, if they're, if it's going to be a train the trainer type piece, or if it's ongoing training. And then, the whole sore piece of everything is if there are things that are tied to funds, to make sure that you have the available funds to continue whatever you start. That's what I have in a nutshell. I'm not sure if there are any specific questions about any specific programs.
Thank you, Tania. Thank you very, very much. We certainly are going to open this up for questions and any discussion at this time. We are able to take questions in the chat for Tania or for any of the individuals, Dan, Robertello, and I, who are on the webinar today. I did see some comments in the chat with respect to how how programs have been implementing and trying to monitor the use of MI within their programs. It looks to me as though several, people who are on the call do have staff trained in that and actually try to also introduce trauma-informed thinking throughout their whole agency, which is very, very important. Some of the comments suggested that they weren't sure exactly how to monitor whether or not the motivational interviewing was being used within the agency. And I'm hoping that some of the suggestions that we offered would be helpful, such as observing group observation, being a group observer, when someone's facilitating a group or an individual sessions, for example, when someone's doing a journaling session, interactive journaling session, something to that effect, because there's a lot of MI used there. I also noted in the chat that some programs do monitor, the use of MI and even use it, and, monitor it within each other and ask each other how they're doing, asking for examples, things of that nature to encourage motivational interviewing language. I think if you have any questions about how to further explore that, you could certainly reach out to myself or Dan Robertello, and we're going to give you our contact information in a moment. Do we have any questions from the participants? I don't have access to the Q&A, Taylor, but I do have access to the chat.
It doesn't look like there's any questions coming through.
Okay. So with that, we have the slide here with respect to contact information for myself at OPCA, as well as Dan Robertello and Nicole Aldi in the ATI unit. I would like to thank you very much for participating in this today. We hope you found the information valuable and applicable to your work. Please tune in for our next Lunch and Learn webinars in this series, which is next week, the week after June 9th, for a presentation of the Ready, Set, Work and Career University, Advancing to the Next Level and Retention Counts. That'll be a really good webinar for you to join in on. And if you're interested in receiving any additional information or training, please reach out to your OPCA representative at any time. And I'm sure you have your representative's contact information. Thank you again, Tania, for joining us today. Thank you so much for the information and for sharing your experience in your programs. And thank you all for coming today. Stay safe.